The push to get more people vaccinated against COVID-19 continues as case numbers surge and Christmas approaches. The Centers for Disease Control showing more than 78% of adults in the state of Wisconsin have gotten at least one dose of the vaccine. Children as young as 5 years old are newly eligible to get the shot. So when you adjust that number for everyone 5 and older in Wisconsin, it does drop down to 71% having received at least one dose. We've got Dr. Kristin Bencik, pediatrician with Children's Wisconsin, with us this afternoon. Dr. Bencik, good to see you. First things first, you are recommending the vaccine for your youngest eligible patients, correct?
Absolutely. Every child 5 years and older should get their vaccine. We know the vaccines work. We know they help prevent death, help prevent hospitalizations, and we know it's really our only way to help end this pandemic.
We've talked about this before, but I'd like to reiterate the point. We do know that children, unlike many flus, children are really less likely to suffer very serious complications with COVID than many adults. So why still are you recommending that children get vaccinated against COVID?
Sure. I think it's important to remember we're still learning about long-term effects of COVID. To say that they might not suffer long-term effects, I think we can't even say that yet. We already have had over 700 deaths in kids, and granted that's low compared to the number of about 7 million kids that have tested positive. But 700 deaths, if we can prevent any of those, is too many. We're also at Children's Hospital of Wisconsin right now seeing 15 kids a day being admitted with COVID. We also know there's a long-term, that multi-system inflammatory disease, which causes heart defects. It can even cause death in kids. And we don't know about kids' brains. The thing about kids in development is it takes years to see what kind of effect things have done with their brains. And so we can't say yet that we don't know COVID might not cause long-term effects with development, with learning and other things. And so I really caution people, yes, we've been so fortunate kids are not getting as sick as adults, but we still don't know long-term effects.
I think, Dr. Bencik, it's interesting because many parents would use that same rationale for saying, I don't trust these vaccines for my children just yet because we also don't know the long-term effects of these mass vaccinations. What's your response to that?
So I think it's really important. I understand parents' fears. I completely understand it. I'm a parent of 4 myself. But you have to understand, these vaccines are not new. What we've done, the process is not new. These mRNA vaccines have been used in the rabies vaccine. They've been used in the HIV vaccines. And vaccines in general, you don't see them causing long-term effects. We really know the effects from vaccines generally 3 to 4 weeks after they're given if there's going to be complications. And so while I understand the fear, I think it's really important. I would definitely be much more scared of the COVID long-term effects than any possible effects from the vaccine.
Dr. Kristin Bencik with Children's Wisconsin. Great to see you, doctor. I hope it's a good holiday season for you and not as busy.
Thank you.
All right. And a reminder, you can find the latest information on COVID-19 and vaccinations for kids specifically up at tmj4.com/coronavirus.